Thank you, Celestine. I know you're juggling a lot of balls at the same time. So appreciate it. My name is Darryl. Great to be with you all. We're going to have some time to just do a quick check-in. If we can go to the next slide. There is a check-in question. I'm sorry. Next slide. Next one. There we go. All right. So our check-in for today. We're going to take some time. We're all going to go to the whiteboard, which has been provided for us. So the whiteboard is a feature here in Zoom. If you look to the bottom of your Zoom screen, you'll see 3 dots above More. If you click on that, you should see whiteboards as an option, and you should be able to go to existing whiteboards and be able to join us all on the same whiteboard, okay? And as that's being pulled up, I want you to take a moment to think about this question. What kinds of data do you currently have? Thank you for whoever's putting that on the whiteboard for us. What kind of data do you currently have? Let's think about your work. There's a lot of us here in healthcare. So as you think about your community work, what kind of data are you currently collecting? What do you currently have? So we'll just take a moment for us to put those in the whiteboard. Again, thank you all so much. I'm going to hand it over to Ron. We're not going to have time to unpack all of these and have a discussion. I just wanted to do a check-in, but I'll hand it over to Ron, who's going to keep us moving.
Sure. And it looks like in the chat, we've also got similar types of data, some commercial tobacco product point of sale data, and focus group data. I just see anyone community engagement data. So part of this, the goal of our webinar today is to think about how to engage community and data and engage with community data. For those of you who've been to the prior webinars, we've talked a lot about asset-based community development, ABCD, and the value of helping communities identify particular data points around the strengths of their community, which is often not collected. Government rarely connects data around strengths. And so we've talked about the process of how to do different exercises that help you get a sense of what a community's strengths are, and help a community get a sense of its own strengths and its own sense of power, so it can get some things done for itself. This one is about, how do we engage folks in data so that the community owns it? One of the tricky things about evaluation and most data collection efforts is that they're really extractive, and they ask people for information or take information at certain entry points like healthcare systems, and don't ever provide back any aggregated amount of data, let alone engage the community. And what does this data mean for you? And what do you want to do in your community because of it? So we're going to look at some ways to do that. If we can go to the slides now, we'll just hide the whiteboard. And Scarlett or Celestine, if you can put the slides up. Great, and the next slide. So we have a workbook, and I think, Celestine, you can throw the link to that in the chat, around using data in community. We want to talk about a particular way of bringing community folks together to engage with data, and some tips we have for that. So I'll start with just telling you a story about a group I worked with when we did a method similar to this. It was a group in the community of Oxnard, California, generally working class community next to a Navy base, and with lots of bilingual folks in Spanish and English, new immigrants. And they, this group had been working in that community for quite a while. And one of the things they did was develop and operate affordable housing, amongst other various sort of community engagement activities. And they did a survey in a part of this neighborhood where they had a housing community and had done a lot of leadership training work, but they didn't just survey their housing community, they surveyed kind of the whole neighborhood. And then they wanted to engage the neighborhood in the data they found and see if the community, what the community thought of it, how they interpreted it, and how they might mobilize around it. So they basically had an event. They brought people together. This can work online, but it often is better in person, potluck, that kind of thing. And they had data points all around the room. So it was a community room type of thing, multi-purpose room, and had data points all around the room. As people came in, they asked them, walk around, and they had a little worksheet similar to the one that we have in the workbook, and asked them, what does the data say? What surprises you? What confirms what you expected to see? People were really interested, especially people who had taken the survey, were very interested to hear how their own answers match up with the whole. And we all see that phenomenon on social media. One of the questions that the organizers had was, one of the questions in the survey was a sort of resident capacity empowerment question around how much people felt like they could make a difference in their neighborhood. And this organization had spent a couple years investing in leadership training and organizing of the people in their housing complex. And they were struck that the people in their housing complex rated themselves pretty low. I think they put somewhat able to make a difference, but people in the surrounding neighborhood rated themselves very high, meaning they're highly likely to be able to make a difference. And they wanted to know, what's that story about? So they also highlighted that particular question and had a visual that showed different sections of the neighborhood and where there was sort of a heat map around feelings of what they interpreted to be empowerment versus disempowerment, and asked folks why that was. So they started with this issue of what are the patterns you see? What does the data say? Had everybody share, and then they engaged in the question of what does this mean? And that's where they really brought up this discrepancy that they had seen between how different parts of the neighborhoods felt they could make a difference or not. And the answer came back, which was that those the folks in the part of the neighborhood that have received a lot of training and been organized to do some things, they had fought for a park and a few other things, a stoplight, they recognized how hard it is to make a change because they had tried it. And so they said, we're somewhat likely to be able to make a change. Whereas those who hadn't really tried it felt like, well, if we tried it, we could do it. So we're highly likely to be able to make a change. And it helped them think about their training and organizing efforts going forward, and also helped the neighborhood understand itself, and helped folks from outside of this one housing community understand why so many people in that one housing community were getting things done. The question around what does this mean? For them, it meant that where this organization invested in leadership training and organizing, that people developed a more layered understanding of what it takes to get things done, and were more strategic, came out of the discussions in getting things done. So that's an example of surprises and confirmations that an organization of staff folks was not able to solve themselves, but by bringing in the community, they were able to better understand something. But then one key question whenever you do this, and those of you familiar with the most significant change methodology of analysis will familiarize this, was they asked, what's the most important story here to share? So we may have, in a discussion, identified 5 or 6 patterns around the neighborhood. This part of the neighborhood feels a little less safe. More large families live over in this part of the neighborhood. More people using childcare or health services in this part of the neighborhood. But then asking what it means gets them talking about those patterns and why they might matter. But then we ask what's the most important part of this story to share. And that's where it helps folks prioritize what's important about the data, which is a piece that's rarely done in communities. It's the piece that helps the community re-own the data and makes it, or at least mitigates some of the extractive and colonial nature of most evaluation and data collection. And it's the piece that helps a community start to be able to mobilize in response to data. So after folks have discussed what are the most important stories to share, we start looking at how do we craft the story. So go to the next slide. How am I doing on time? So, this is not rocket science, how to tell a story. I think we learn it in 6th grade or something, and then, people get master's degrees in it in the USC Film School. Basically, who's the main character? Who's the person we're rooting for in this story? Who else is involved? And what does that say about themselves in their story? So think about the data you have in your community that we just talked about. A lot of it is, community-wide data with lots of demographics and stuff. Who are the main characters in your story? Is there a main character? Is there a character you can create who signifies or represents this data that in your community story that you're rooting for? And go ahead and write that down because we're going to use it in some discussion in a little bit. The next piece of any good story is a setting. Is it a neighborhood? Is it a town? Is it a county? Who lives there? What are the ages, backgrounds? How long have people lived there? That's where a lot of the demographic stuff can be useful that we're usually able to find in secondary data. What does the data say about who lives here? But also, if we have some primary data, or if we bother to go out and do some asset mapping, this is important because we want to know. Let's see. Thanks. We want to know, what are the gifts of the people who live here, because that starts to tell us something we can work with. Then the third part of any good story is the plot. What's this data tell us about the main characters? What are the challenges and obstacles the characters face? What's happening in the area? What do residents say, and what do other stakeholders say, and are those different? And what changes are happening or have happened? In most communities, there will be a narrative already, and it will have been defined by the media, politicians, and grant writers who will tell the story of a neighborhood of what happened. And they might say, this neighborhood is a poor and violent neighborhood. And that's the story. But as you talk to residents, you find out there's more to this neighborhood than that there's lots of people with lots of gifts and skills, and there's a story here. Most of our stories around systemic racism or economic shifts that left people behind help us understand more to what the common narrative is. But again, as we've talked about in prior webinars, spending some time learning the assets of a neighborhood can help us understand that story as well. And those are things residents can tell us. So that's all part of the plot. Whenever, I'm called to work in a neighborhood where there's some sort of stigmatization story, the first things I ask is who's here and what do they love about their neighborhood? And people will answer that with stories that often have a common thread that you can call together. So think about a minute, the neighborhoods you're working in addition to the labels that are garnered from the easy stories created by media and those of us, when we need to write grants, we often tell a story of how a neighborhood, everything's terrible. And then when we write for the grant renewal, we have to say everything's terrible, but we made it better, but it's still too terrible. So you have to give us more money. How do we get out of those stories? How do we get to the stories of resilience and of accomplishment that is where the future possibility of a neighborhood lies? What do residents say about those things? And then there's the call to action. How do we move forward? what action should the audience or the listener take? What needs to happen now? Sometimes the action is to collect more data to better understand what's going on. If you're talking to a neighborhood and there's a common narrative, but there's also other sub-narratives under that, but nobody can really tell you except for some anecdotes about why those narratives are true for them, it might be time to collect some more data, some primary data that really speaks to that community. I was working with youth in Aurora, Colorado, around some issues that they really wanted to focus on how they could make it a better place for youth. They were getting money around tobacco and drug use prevention, but they felt that those things were best prevented by having some positive engagement opportunities for young people. But there's a lot, the stories of rural Colorado are a lot of difficult things, and in its history. And so I asked, when have people here come together? What's part of, where's that plot in your past? And they all talked about the theater shooting when at an opening of Batman, I think a guy came out with a machine gun and shot a lot of people, which traumatized the entire community. The response to the community was leaders and local government set up sort of spaces. I can't remember what they're called. They're kind of like wellness centers, but they were just spaces where you could go and be and talk to people. And they were scattered throughout the community. And these young people who were teens when I was working with them, but elementary school kids, when it happened, they could talk about these places that they would go to with their parents or their older siblings, and how some of them still existed. And they wanted to renew that sort of space where people could go and connect. That was their call to action. And it was rooted in a story that the top line story was a disaster, a mass shooting, but the subtext story was a community leaning on itself and supporting each other. And they felt like that's where young people could have space to lean on and support each other and identify positive and constructive activities to engage in and to recruit their friends to engage in. So we took some data, we took their interpretation of the data, their version of the plot, and turned it into a new call to action. So I'm going to hand it over to Indigo to give you, I think, what's the next slide? I think this one, which is then, after you do this process of what's the data say, what's the data mean, what's the main character setting, plot, and call to action, circle back and fill in the plot with data, especially primary and qualitative data where possible. And if you don't have that, then the next action, as I said, might be to go get more data and to help the community get it for themselves. So it's not just external and controlled by outsiders, but ideally owned by insiders. So Indigo, you want to lead us in some discussion, and then we'll hear about examples from Michigan.
Sure. And I think we're going into breakouts for about 10 minutes. I think we're going to be in groups of 3. There might be a couple, if our numbers are off, couple groups with 2. But and we're going to answer the question, what do you think the story is, and how can you engage community in the data collection process and the in that process of crafting the story. So you'll share that with each other briefly. Try and keep it just under 2 minutes each. If you aim for 2 minutes each, you'll have a little time left over to elaborate or ask questions of each other. And hopefully this is a good opportunity to share and hear what other folks are thinking and learning too. And then we'll come back and do a quick debrief before we move to the next section. Okay, looks like most of us are back, and we have a few minutes to just to share anything that came up that either one of the folks in your group shared that you think the rest of the room, the rest of the group might benefit from hearing, or if there was something that you shared that was particularly stood out to you or that you'd like to share a larger group. now's the time to do it. So anybody want to share a piece of the meaning that you took from the story, or how you included the community in evaluating what your data meant?
If I can add something, my name's Jerry. You know, one of the things I've seen in our forums is the frustration of people because they may have participated in previous forums and they don't know what happened for last year, or, you know, what are the results from last year. And I think I think we're missing people that used to come and give us feedback because they are disenchanted. And I think we need to spend more time to acknowledge what we learned in the past, what's been done, and what we're trying to do now, and how we're going to report back to the community. Because I think we're missing quality, or we're missing opportunities to collect quality data if we're just talking to a room of people that are there for the pizza. Thanks.
Absolutely. No, that's a good point. And someone, I think Adria put it in the chat also, a similar thing about how to share the data collected back with the participants who shared the data in the first place, to let them know how it turned out or what you decided from the information that they shared. That's a huge thing. And I know from personal projects I've done, it can be hard to get the data back to them, but how important that is, not just for your project and the trust that you build with them, but for future projects too. Anybody else want to share? I think I see a couple things in the chat. Okay.
I was going to say, this is Phyllis with the Kidney Foundation of Central PA. The other thing that I think is important is that we have to evolve and learn from the data, because what we collect may not be what our constituents, patients, users, participants, whatever we want to call them, it may or may not be something that they feel is of extreme value. So we need to be willing to segue into their feedback that says, yeah, this was interesting, but this is not really as relevant to me as something else.
Mm. Yeah, where you're saying where you've interpreted the data in one way, or the folks who've completed the survey or collected the information have interpreted it a different way than the respondents.
No, not necessarily. I think that sometimes we discover that there is a sub issue, or that there is another overarching area that we need to kind of segue and move into investigating or investing in. And it's not enough just to report what we learned, but to learn from what we learned. And if we need to, move in another direction to address the underlying issue.
Yes. That's a great point. And I find that that's often the case, where the people doing the survey already have an idea in their head of what the issue is, or what the solution is even. And then sometimes that's so cemented in our heads that it's hard for us to actually see and acknowledge when the community is saying it's actually a different thing that we'd like to address. Like, that's whatever you're asking me about is secondary or tertiary or whatever it is. The real issue is X, Y, or Z.
Exactly.
And it's very common for us to ignore that or push their answers aside and say, no, we know best. That can't be the first line of action, when we really need to have that trust and to know that we've asked them for a reason, and we need to move on the answers that they give us and share them back with them. Yeah. And learn from the process as well. All right, I think we're probably out of time. Scott put in a note about leveraging the power of data. How do we create influence by using language that's perceived by different political interests with empathy and an open mind? Ooh, this looks interesting. I'd love to hear.
That's a whole nother session.
Yeah, I'm not sure if we have time to jump into it, but I'm very curious to know more about what you're thinking, Scott. Feel free to put more in the chat if you'd like. But I think I'm going to pass it along to Celestine to take us to the next section.
Thank you, Indigo. Yeah, so our next presenter is April Osburn, who's joining us from the Central and Western Area Health Education Center. So welcome, April.
Thanks, Celestine. All right, well, good afternoon, everyone. As Celestine said, my name is April Osburn. I'm the Executive Director of the Central and Western Area Health Education Center, otherwise known as AHEC, which is AHEC. Some of you in healthcare settings know how much we like to use acronyms. So if you ever see AHEC, you know that that stands for an Area Health Education Center. So next slide, please. I always like to talk to you a little bit about what an Area Health Education Center is, just in case some are not aware. I will tell you that Area Health Education Centers are actually in 48 out of the 50 states. Or actually 45, I think it's 48 now. Most AHECs are federally funded by a HRSA grant or somewhat supported by their host site. AHECs all across the country, all the states look a little bit different, have different demographics and population groups, but the focus areas for all AHECs is to recruit, train, and retain health professions workforce in those communities and within that state. Next slide, please. So this is a little bit about what the landscape looks like here in Michigan. And I will say, for those of you that are on the line from Illinois, I know Illinois has a pretty well-established area health education center. I believe it's actually been around longer than Michigan. The Michigan AHEC system has been around for about 13 years. So we are really one of the younger area health education centers. And the area that I represent on the map, if you look at the Mid-Central Regional Center, and then if you look at the Western Regional Community Consortium, we are the nonprofit that is the 501c3. That is actually 38 counties, 22 of those counties being rural. And so we are a separate 501c3, like I mentioned, that's housed within an academic institution in the CMU College of Medicine. That's kind of right centrally located in the center of the state, if you're familiar. Some of the other regional centers in Michigan are made up of federally qualified health centers. So you have the Upper Peninsula AHEC, you have the Northern Lower AHEC, and then you have the Southeast Regional Center, which is primarily your Detroit-based. And the program office that actually applied and is the recipient of the Area Health Education Center grant from HRSA is actually Wayne State University Medical School. So they have subcontracts with all of the other regional centers, us being one of the subcontracts that actually runs two AHECs into one. So that's where you see that 38 counties there in the Mid-Central and the Western region. Next slide, please. And again, happy to answer any questions, just like the rest of the group at the end of the presentation, as I'm going to provide just some high-level information for you just to kind of make sure I stay within my time. So AHEC has many linkages, and some of that is really stated from the prior slide where you see how we're developed. Some of us are academic health centers. We have the AHEC centers, and within those academic AHEC centers, we're made up of communities, right? It's all healthcare based. So it's hospital systems, practitioners, schools, public health associations, clinics, and healthcare centers, advocacy groups, because our 501c3 does have a nonprofit board and a community advisory board. And that community advisory board is really made up of some of your grassroots-based community organizations, some of your other FQHCs and healthcare systems, and then again, some of your other academic institutions as well. Next slide. So here I'm going to talk again a little bit about the mission and pillars of AHEC is the recruit, train, and retain. So one of our focus areas is pipeline programs, which is what I'm going to spend the most of my time talking to you about. But then the second thing is the community-based student education. That's really where we work with some of our students who, whether they're a medical student, a physician assistant student, or nursing student, and really working with those students to try and embed themselves in the communities in which they're placed to complete their clinical rotations. It's not just completing their clinical rotation, but it's learning about the population and embedding yourself and learning about those communities in which you're placed. And then the continuing education programs, we provide different types of continuing education programs to our rural providers, our urban providers, you know, specifically on different types of healthcare topics. For instance, like human trafficking, opioid abuse and education, implicit bias training. Those are all types of trainings and educational opportunities that those living and working in the health profession settings need to know to continue some of their education. Next slide. This is where I'm going to talk a little bit more about, this is what our program is really aiming to increase, and it's centered around our work. Like, one is the intent of grades 9th through 12th grade students to pursue careers in healthcare. Again, this directly aligns with the mission of our grant, but it also aligns with the mission and vision of the medical school in which we're placed. We're here to increase the rate of college enrollments from students who are living in a medically underserved areas or any other type of disadvantaged population. And that can be in rural or urban areas. We aim to increase enrollment into health professional training and education. And that could be increasing, you know, those that want to become an EMT, maybe someone wants to go to nursing school, go on to medical school. It's not just about becoming a physician. As we know, there's multiple avenues and areas in the healthcare setting as well. And then overall, we want to increase the number of health profession students wishing to stay and practice in Michigan. As we all know, especially those of us in the healthcare system, you know, we have a health profession shortage area, and especially in some of your rural areas, it's very hard to recruit providers to live and work in those areas if they're not from those areas. So next slide. So we really look at the grow your own type of health profession network. Studies indicate that early intervention programs significantly affect a student's choice of a healthcare career. Health profession students and residents initially take jobs and serve where they are trained. So let me just stop and say, when you think of a medical student, after they graduate from medical school and become a physician, they go to a residency program. More often than not, those residency programs are in some of your larger urban areas. And so we like to think that for some of our medical students during their training, when we've given them the opportunity to do clinical placements and trainings in some of those rural or underserved communities and some of those areas from where they're from, they will learn about some of the other assets and really purpose about why they want to serve some of those other communities. So we're hopeful that some of them, even after residency, will go back and live and work in some of those underserved communities and also move back to some of those areas where they were raised as well. Next slide. So we have a variety of a health career pipeline program or pathways programs that we have in place throughout the 38 counties that we serve. So these pipeline programs, they're built upon the mission and vision to empower high school students to pursue careers in health professions. And again, that can be any type of health profession. So some of the locations in which these programs are held, and I will tell you that they're in-person programs too. Occasionally there may be a virtual option, but more often than not, they are held in person. And so if you're not familiar with some of these areas, Mount Pleasant is a rural, underserved area. The Thumb region, Huron, Tuscola, Sanilac, Lapeer counties is in the thumb of Michigan, just like how it's stated, which is your farming community, very rural, smaller population. And then you have some of your urban communities more so in the Saginaw region and the Grand Rapids, Kalamazoo region. So those are kind of like the 4 pockets, you know, of the state where we conduct our work. And talking about these programs a little bit, they are geared towards students who are 9th and 10th grade students. We look for them to be first-generation college students, again, who live in some of these locations that I've provided, and to genuinely share an interest that they have in learning more about health professions. Maybe they have a story to tell that has impacted their life or their family's life that revolves around healthcare, and they want to learn a little bit more about those careers. And they wouldn't otherwise have access to these types of programs if they weren't provided by our Area Health Education Center, because these programs are free and there's no cost to participate in these programs. Grant funds support these programs that we have. Next slide. So the structure of these pipeline programs, it's really built upon a mentorship structure as well. And so this graphic outline really kind of showcases this a little bit, where you have one high school student who is paired with, and right here I say a CMU pre-health mentor, but because we have these happening in other communities, these pre-health mentor students are from like Saginaw Valley State University, they're from Ferris State University, they're from Central Michigan University, Davenport, Delta, some other types of community colleges. And all of these students who serve as mentors to these programs are from the areas in which these students represent. So these high school students are able to create a relationship with someone a couple years older than themselves who grew up in some of these regions where they live, and can also talk about their move to post-secondary education, what that looked like, talk to them a little bit about some of the experiences that they have within the communities for where they're from. And they get to participate with these students every week throughout the different types of offerings that we have for the program, which I'll get to just in a minute. And it's a 9-week longitudinal program, and it's MD student facilitated. So these medical students that help facilitate and run the program with our office, these medical students are also first-gen college students. They came from a rural or urban underserved community. So again, we have kind of like a 3-layer ship of a mentor type of experience, where all of these students have they're different, but they also have similar interests and similar backgrounds. And then on the outside, you'll see where we have collaborative healthcare professionals and organizations. So those 4 communities that I mentioned where we have these pipeline programs, every week we bring in individuals who live and work in those communities and who are part of the healthcare system based on whatever the topic is that week. So again, you're having the high school student, your student who's enrolled in a health profession that has yet to finish college, you have your medical student, and then you have the individuals in these communities who are kind of tying all of that together for those students. Next slide. So here is just an example of what like an outline changes every year. We have different offerings. You'll see that there's mentor orientation and training. We have a program launch where we introduce different types of leadership characteristic traits, give the students a nice little overview. And it's also an opportunity that first week for those students to get to know their mentors and their medical students, just kind of sharing some of their personal stories, their backgrounds, their interests, and how they got to be where they're at today. And then throughout the course of those other weeks, the students are exposed to a variety of types of health professions. You know, there's health and wellness, simulation lab scenarios, career nights. They could hear from an athletic trainer, an occupational therapist, maybe an RN, someone from the public health, maybe someone who's an epidemiologist or someone who collects data. Students are just exposed to a variety of different types of career paths that are available to them in the healthcare setting. And then additionally, they're kind of given the tools and the information that they need if they were to want to pursue any of those types of professions, or what that path looks like in their educational journey. Next slide. So here is just kind of an example of me kind of telling you a little bit of the stories. So this program represents a program that's in the Thumb area, which I said is like Tuscola, Sanilac, and Lapeer. This is from a very rural area. It had 10 middle school participants, but in some of those pictures, you can see that some of those students, one student is actually watching the solar eclipse that they were able to participate in as part of their session. But then in another one, there's students who are actually visiting a clinic, hospital within the community. One, it's great for them to visit that hospital and clinic where they're not there as a patient. They're just there as like a community member, talking to the individuals, again, that live and work in their communities, and also seeing how do they serve their community. Next slide. So we have some other pipeline programs that are part of our region that are more in your Saginaw area. And we do collect data on all of these programs. It's not only a requirement of the grant, but also as part of our medical school as well. So as I'd mentioned earlier, some of these programs are 9 weeks consistently. As you can see, we had 26 high school participants with 12 SVSU college mentors. So more than likely they were 2 high school students to 1 mentor, 22 guest speakers from the community, and 12 different medical student facilitators. And I will say those medical student facilitators don't just come from CMU, they come from some of the other medical colleges in the state. But you can see we do collect some of the gender and ethnicity rates as well. Next slide. And then after they provide us with some of that data, we also try to find out, are you a first-gen student? What did maybe the career or educational path look like within your home or your setting? So here, this is where you can see kind of what some of those race, demographics, and educational levels looked like for our participants and our parents and guardians of those students, which we collect this information on all of our programs as well. Next slide. And here is just some pictures of kind of showing you what some of these sessions look like. So we had a hands-on health event at our simulation lab and skill building event, which is part of the College of Medicine, AHEC, and Thumb Community Health Partnership. So for this program, we brought together rural and urban students who were 9th and 10th grade students to a facility in Saginaw where the students went through like a casting and suturing clinic. They went through different types of simulation scenarios where they learned how to do CPR, they learned to stop the bleed, they learned how to administer Narcan if they would have to do that. And then there was a community panel of those from the community that came in and talked about their career paths. We had someone who was a nurse, we had someone who came in who was part of the public health system, we had someone come in who was actually a resident, but had 3 times applied to medical school, joined the armed forces, went back and got like a bachelor's degree, then they went back and got a master's degree in public health, and just talked about their overall journey and kind of continuation to not giving up with some of their aspirations and dreams that they had about joining the healthcare setting. And so you can see some of our students going through the variety of scenarios that we provided. And again, the leaders of all of those sessions were residents, medical students, and also some of our community healthcare professionals that came in to really guide and help these students. Next slide. So here are some of our pipeline program numbers specifically. This is in your Grand Rapids area, how this program is set up. So our AHEC actually does this in partnership with Western Michigan University and Michigan State University as well. So even though we're housed within CMU, we have other academic partners and community members who are dedicated to the same vision and mission that we have. And so this is just giving you some of the stats of information that we have on the program. Next slide. This was really a great session that we had, and this was for our students, again, that were from the Grand Rapids region. This session, particularly from the pictures, this is Gift of Life coming in to talk to the students about organ donation, what that looks like, what are the benefits of organ donation, and then also talking to the students of the variety of careers that the Gift of Life can employ for this program. Next slide. Here's another on-site session with students who are engaging with some of your local community members who are paramedics, some of your local community members who are ultrasound techs. And you can't really tell on the screen there, but the individuals who are laying on the gurneys, those are not mannequins. Those are actually community members who have volunteered their time for these types of training activities. Next slide. Again, here is some data that we collect for our programs. We do have to collect gender information, parental educational levels, ethnicity, And then some of our core areas is like, we want to increase the rate of first generation college students. That was 37.5% out of the students that attended the program, and 100% of the students lived in an underserved area. And again, underserved just doesn't have to be rural, that can be urban as well, which all aligns with our mission of the program. Next slide. Again, here's just some highlights so you can see of some of the happenings within the community and the healthcare settings with how our students are becoming engaged and involved. It really helps us kind of tell our story about the successes of these pipeline programs, how it aligns with our mission and vision, and what we do and why we do it. Next slide. And again, here is an All About Nursing event where our office came together to work with a multitude of different types of systems: Blue Cross Blue Shield, Western Michigan University, Corewell Health, Ascension Borges, and AHEC to bring in this event. There was actually 70 students from the Kalamazoo region that were interested in learning about all the different types of careers that are available to you in the nursing setting. Next slide. So I also want to share, because I was limited on time, because we collect data on all of these programs, we do longitudinal tracking, of these students as well who go through the program. So we continue to offer ongoing type of programmatic trainings and opportunities, because as you can imagine, when we see some of these students as a 9th or 10th grader, how can we prove that they went on to post-secondary education? How can we prove that, some of the medical students that were part of our program after they went into residency, did they go back and live and work in a rural and urban underserved area? So we continue to have touch points and additional offerings for these students. And then we follow up with them over time so we can report all of these successes and all of the data. And as being part of the medical school, we always like to see that, especially some of these medical students, not once they went into residency, then they went on to serve primary care, which is definitely, we're lacking primary care in some of our rural and urban areas. So we want to see that they follow through with the mission of our College of Medicine as well. And do you care if I answer some questions that are in the chat box? Is that okay?
I think we've gone over a little bit, so I will close this out really quickly, and then if we want to move into the Q&A portion, that would be great. So yeah, thank you everyone for joining us today, and sorry we went over a little bit. You can find the slides are on our website, and we will also share those via email. There is a sign-up form for office hours if you're interested in participating in that, maybe having some more personalized time with the ABCD coaches with your specific questions. So you can go and fill that out there, and I'll send that via email. And then, yeah, the recording will also be shared via email, and we will have a survey as well. So keep an eye out for that too. But thank you so much, and then we can proceed into the Q&A portion.
Yeah, April, go ahead and answer some of those questions that have come up about your presentation, and then we can open up to other stuff.
Yeah, thank you. I just answered one in the chat. So because all of our programs are either grant funded or we apply for additional funding from like the Community Foundation, some of these programs we really receive funding from the communities because they're trying to grow their own within their community, and supporting some of these programs is very important to them. So all of these programs are free for anyone that attends. So, if community members attend, that's volunteer. Medical students, volunteer. But also it's a great thing for them to use on their resume, right? Especially when they're applying to residencies as well. And we have enough funding where we provide food for every type of training or camp or offering that we have. We're able to provide any types of materials that are needed for the students to use as well. And if students, have a hard time with transportation, right? I mean, it's from 5:30 to 7 o'clock at every night. Maybe parents work, maybe there's not another car that can get, students. If they want to participate, we'll find a way, whether it's a gas card, whether it's providing funding for an Uber or some type of transportation. We'll do whatever we can to accommodate their requests. And if they want to participate, we're going to find a way to allow them to be there.
Thank you, April. Does anyone else have any other questions they would like to ask? Or I know there was a question earlier. If anyone would like to come off mute and ask that.
Looks like there was some discussion about story versus messaging. I think those are important distinctions to make. I think what we're trying to assert here is that, at least in my experience, a lot of times professionals will look at data from a community and then craft a message to decision makers based on what they think is effectively leapfrogging the community's interpretation of the data. And that creates a couple problems. One is that often the new policy or new program doesn't land any better than the last one because key interpretations of data were missed. And it continues to detach the community's data from the community, which is something we've tried to emphasize in these webinars, is that data generally comes from community members, community residents. And so it's really important to circle back with them as a group and give them a chance to engage with the aggregated data and talk about what it means. Otherwise, it's extractive and colonial and not particularly ethical, but definitely ineffective as well. So it's great if messaging can be done with the community after it's had a chance to interpret the data and point out key items. There's an example we have in the workbook about a group of young people I was working with who learned that the park district was going to redo a park in their area. And the data that the planners had suggested that they build a new baseball field. And the youth went and collected. The youth had a different story. And we pushed on the youth to say, well, find some data, find out what's real in addition to your own perspective, because you're advocating for the whole neighborhood here. So they did some observation data and put it together and showed that the community wanted different uses of the park. So that's one example that's in the workbook of why it's important to, before messaging, make sure the community's had a chance to interpret it.
Do we have any other questions?
There's such a lull there. I'll throw one in. We tend to, our county behavioral health system tends to have forums every year, and we started dividing out the providers from the consumers because we were oftentimes getting very few consumers and a lot of providers, but it seemed like they were consumers, so we never really asked, what your role is when you're giving responses. But now they, I think 3 years ago, they split the two, and we had like 110 providers show up. So it was an amazing amount compared to the 2 or 3 or 4 that would show up to the forum. So I'm just wondering if that's a best practice to separate out, you know, providers from consumers, and if they do attend, if providers do attend the consumer events, are they asked to kind of hold their thoughts and you know, ideas, or just so they don't get blended into the consumer responses?
Who wants to take that? April, how do you guys bring in, you know, you engage a lot of young people, and I imagine a lot of the programming is designed without them. How do you engage them in discussions about which ways to go forward on things?
Sometimes we can engage them by holding like focus groups where we're going into schools, maybe we're going into communities, and we're inviting those that we have already had as part of our programming, but then also we're inviting those within the community. And so when we're trying to spread, you know, some of our messaging and some of our data and some of our successes, but also trying to learn from others, right? And to see what they have to share. And I don't ever like to like proscribe things. It's more of like just like asking and listening, and then like taking all of that back and looking for some themes and some ideas. And then from there, like doing some follow-up with those that have been involved and try and pull like a couple of key takeaways to develop like some of the next steps, and maybe seeing like who else should we be engaging with in the community? You know, who else should we be partnering with to try and move some of these things forward?
Great.
I would just add to that. I think it's also important for us to include the community in the data collection process. So not just asking them to come to a meeting, but how does the community itself? So I had shared last month the group that I lead with youth. Our youth, we just got done celebrating 50 community conversations that they've had with neighbors. But the youth were a part of that, and in part of our celebration was highlighting the data that the youth themselves had collected. And then we're going to have someone come in who is really excited about numbers, right? Walk us through some things. But I think it's important to figure out like, how do we involve the community in the whole process and to co-create with them, rather than inviting them to an event and then doing a follow-up.
Yeah, that's key. It also means more of them will likely attend the second event.
Right. Yeah.
12:47 p.m.
Jerry, some of the dynamics you've talked about too. I mean, my habit, often providers are convening something that's a role they can play. So I often build in time to meet with them before community members get there to talk about how to hold back, how to make space, how to not dominate. And we sometimes even practice. Just
yeah,
listening.
even as facilitators, we do a bad job of using acronyms and, you know, assuming that consumers are well aware of even foundational stuff. So that, you know, that's something to be mindful of as well, as you know.
I just got a hungry cat.
Oh, I've got an annoying cat. Yeah, she just talks.
Any other questions before we adjourn?
I got to ask one more if there's a law. I'll be real quick. Does anybody use any kind of technology to you know, pull answers from the community so that you can identify the role and responsibility and demographics of the individual respondees, even if they're anonymized. The idea being, you know, you understand the perspective and the context of that person's reply.
Do you want to know different types of like systems or platforms that maybe we use to kind of send out to garner some of those like responses that you're asking?
Yeah, and I'm just curious if it's more verbal, one-on-one, asking a question, letting the group, you know, little tables give answers, or if you've ever used like a more systematic approach, like with a mobile phone app or something like that.
Yeah. So we've used both. Like I said, there's mini focus groups where we sit down and we just listen and ask questions and then kind of take all of that in. And then there's other platforms we use by like creating surveys. We use different types of like phone apps, like simple texting, which is like customized links that we send out, and to garner different types of responses to different types of set of questions. Most of the time, we use different systems for the different populations. So like if we want to ask questions from high school students, like it's very specific. If we're looking for community members, we may have like a different type of like, whether it's an email listserv or maybe contact information to local community organizations that will then send that out into the community. So we use multiple platforms and we try to use the best one for that population that we have seen so far.
I've used Mentimeter and things like that in meetings. So we'll have a group of people. We may start with just to get the juices flowing after an icebreaker or something, a poll question that gets texted out or using a QR code, asking people, you know, to name the major issues in the community. And then we'll present some data and then ask them to answer it again. And then we'll ask folks to have some conversation about, you know, what did the data confirm for you? What did it change for you? As just ways to getting those conversations going. You know, what else do you want to know more about? It is, again, important in doing those things, remembering that a lot of the data out there about communities is deficit-based. And so sometimes it's worth inserting, you know, even if you haven't done a full asset map in a community, just taking a look around and including some of those things in the data, you know, number of recreation centers, number of clubs that we know about, number of churches and mosques and synagogues and those kinds of things, so that people feel like they're working with something as well. I was working with one community health coalition that was very concerned about they had data around heart disease for Latino men in a particular community, and we're very concerned about that. But we didn't call people to a meeting about that. Nobody wants to come to that meeting. We had a general community meeting about where the future of the community, and we did some asset mapping. And then the folks presented some data they had too. And then we asked people, okay, using the assets you identified in the first part of the meeting, is there anything you want to do to address what appears to be an issue that obviously is not visible to people, which is, you know, a high heart risk for Latino men in the community? And they tapped into some assets, stories in the past of the community. You know, people used to walk in the evenings and everything, and why they didn't anymore, and what could happen to make that happen. And they, you know, basically started a whole community health program, if you will, that was led by community members around walking and exercising together in the evening, which, you know, engaged hundreds of people, versus when they had the year before offered classes in, you know, reducing heart disease through lifestyle and diet. Nobody attended. You get to the same outcome, but the way you engaged people with the data was different. which also changed the response and who led it. Wallboarding, yeah. Thank you, April, for putting this up.
I think we have time for one more question if anyone has one. I'll take silence as no more questions. Well, thank you everyone for joining today, and yeah, keep an eye out for those emails. And yeah, a big thank you to our presenters as well.
Thank you, everyone.
Thanks, everyone. Bye-bye.